Okay, I think I'll go ahead and get started if there's no objections to that. So let me just, okay. So thank you so much everyone for coming. Thank you so much to CHIPS for having me present today. I did want to let everybody know that this is being recorded. The materials will be posted, I think, on the CHIPS website, if that's right. And also, if you have any questions afterwards, or if you want to reach out to me for a copy of the slides, feel free. My email address is on this slide. So my name is Bethany Myers. I am a research informationist, which is a very fancy title for a librarian. I normally work in the biomedical library on campus, which is in the Center for Health Sciences. But right now, I am working from home. So I am going to be presenting today about the NIH public access policy and various things related to how to make your publications compliant, and answering along the way, hopefully, any questions that you have about this policy. So as far as asking questions, please feel free to unmute yourself and just at any point, if something that I'm saying you want more clarity or you have a question about it, please just unmute yourself and ask. If you don't want to ask on the microphone, that's totally fine. You can ask in chat. It may be a little tricky for me to monitor the chat, but I believe that we have somebody doing that. So yeah, feel free to ask questions via chat or on your microphone, and I would like to answer them as we go. I don't want you to forget your questions, although I will give time at the end for additional questions. Great, so I'm going to get started. So NIH public access policy. So what is this public access policy? So this is for people who have NIH funding, and this public access policy is a law to ensure that the public has access to the results of NIH-funded research. This policy exists to create an archive of NIH-funded research publications. So this is something where they want to have a permanent record of things that the NIH funded, publications that the NIH funded. B, to advance science. So making science open. There's a lot of research showing that that's good for science, that the more people that can read a paper, the more citations, the better that is at just advancing scientific progress. And C, access. So access to the public to their taxpayer-funded research publications. So when I'm talking about this policy, keeping in mind that this particular policy is for, the one I'm going to be describing is for people funded by the NIH. There are other policies for other federal agencies as well that may be similar or different in their requirements. But the one we're going to talk about today is specific to the National Institutes of Health. So what is the NIH public access policy? It actually, tangibly what it is a requirement that asks scientists to submit their final peer-reviewed journal manuscripts. So this is going to be your final version of a paper that you write, not necessarily the journal's final version of the paper, which we'll distinguish between that later in the presentation, but it's going to be your final version, the last version that you were typing up yourself. And you need to submit it to a database called Pubmed Central, which I'll describe shortly. The maximum embargo is 12 months. So an embargo means how much time between the publication of the paper and the ability of the public to view it freely online in Pubmed Central. And I'll say what that means and how to do it later on in my presentation. So there is enforcement of this public access policy. It's not just a request. So basically, the way the policy works is once your paper is in the Pubmed Central database, you get an ID number. It's called a PMC ID. And this number is going to be requested in the future when you renew your grant. They're going to ask for the papers published on that grant. They're going to ask for the PMC IDs of those papers. And if you can't provide that number, your award is not going to be continued until you've shown that you have that number and that you have made your papers compliant with the NIH public access policy. So when the policy first started in 2008, it didn't have this enforcement. And so, of course, if something's not enforced, a lot of people don't do it. And then once they started enforcing it a few years later, there was kind of a big scramble where everybody was like, oh no, my grant is not I'm not getting my money. And they had to go back and do all this with their previous publications. Now, I think, you know, people with continuing awards have gotten used to this, but if you're a first-time PI or a first-time author on something that was NIH funded, it can still be kind of a confusing process. So that's why I'm going to go through it, hopefully in detail. And again, feel free to stop me and ask questions at any point. So before I show you how to comply, I think it's helpful to look at what this Pubmed Central thing is. So like the point of the NIH public access policy is to get your papers into a database called Pubmed Central. So what is that? Well, let's look at it. So Pubmed Central is a full text database. So it is not the same thing as PubMed. It's very confusing because their name sounds the same. They look very, very similar. As you can see, this interface is not that different from, well, I guess PubMed looks different now, but it's not that different from how we're kind of used to PubMed looking. But the difference between Pubmed Central and PubMed is that PubMed is just an index database. So when you search PubMed, you've all probably had the experience of doing your search, and then all you find in your results is a title, an abstract, and then to get to the whole paper, you have to link out to it. In Pubmed Central, the whole paper is in here. So the full text of the paper is here. So you can see it's definitely smaller than PubMed. There's only 6.8 million things in Pubmed Central compared to, I don't know, 30 million or something records in PubMed. Let's see an example of what that looks like. So this is, for example, something that you would maybe find when you were searching PubMed. And you can see at the bottom of that record there, circled in red, there's a number that says PMID. I know it's small on my screenshot, but hopefully you can see that. And it says PubMed, index for Medline, and then next to that it says PMC ID, free PMC article. So you can see the PMID number and the PMC ID number are two different numbers. Those are not the same thing. They sound very similar. The only difference there is a C, but they are two different numbers. PMID is a record for everything that is in PubMed. So that PMID is referring to this page where there's a title, an abstract, etc. You can see over here in the top right where it says full text links. That's how you would actually get to the whole paper from PubMed. And sometimes there's only one, sometimes there's multiple full text links. But then the PMC ID being a different number, and the fact that it says free PMC article right there, is telling you that this was also funded by the NIH, and that this paper has this link over here in the top right, the full text link going out to Pubmed Central. So when you click that link, you see something like this. So this is that paper in Pubmed Central. So it's a different page, and I don't have it in my screenshot right here. I'm only seeing the abstract. However, if you scroll down, you would get the full text of this paper. So it wouldn't just be an abstract. It would be the entire text of the whole paper itself. You can see at the top, it does have information on where else this was published. So this wasn't published by Pubmed Central. This was published in the American Journal of Men's Health. And they have a link to the published version of it up here. However, the version that's in Pubmed Central, you can see is the author manuscript. There's a banner up there saying that. And this was the final peer-reviewed, finally edited by the author version that they uploaded to Pubmed Central. And that's what everybody can read here. There may be minor differences between this version and the published version if you click through to the journal. There may be some minor differences there. Just because, you know, there may have been some last minute changes by the journal, and obviously the version by the journal is going to be like typeset and things like that differently. But this should substantially be pretty much the same paper in Pubmed Central. Okay, so I know that the distinguishing between PubMed and Pubmed Central is a little bit confusing. Does anybody have any questions about that before I go into actually getting your paper into Pubmed Central, doing your deposit? Okay. So moving on, how do you act? Oh, sorry, go ahead.
Sorry, I have a question, but I'm not sure if, you know, it's not a good question or something we're going to cover later on, but is the process for getting a PMC ID different from getting a PM ID?
That's a great question. Yes, that's a great question. So yes, it is different. So a PMID, go back here. This PMID down here in kind of the bottom left of this bottom red circle, that is something that you don't have to do at all. Like PubMed assign the journal sends their information to PubMed, PubMed ingests it, it just goes into the database and automatically gets assigned a PMID. Everything in PubMed has a PMID, so that's totally out of your hands. You have no control over that. So you don't have to do anything for your paper to have a PMID. It's just whether or not it ends up in PubMed. The PMC ID does kind of rely probably on the author. Either the author has some say in that, because the PMID is the PMC ID. See, it's hard, it's very confusing even to talk about. The PMC ID is a result of whether your paper was funded by the NIH or not, and whether your paper ends up in Pubmed Central or not. So you can have an NIH funded project publication that you never put in Pubmed Central and it won't have a PMC ID. That's in violation of the public access policy, but you could write something that was NIH funded and never put it in Pubmed Central and it would never get a PMC ID. You could also have things with the PMC ID that we're going to distinguish between these in a few minutes, but there are papers with PMC IDs where you do all the work, like you, the author, have to get the PMC ID. There are other versions of it where the journal will get it for you. So we'll talk more in detail about that. But yes, the process, the PMID, you don't have to do anything. That's just whether or not your paper ends up in PubMed with a record in PubMed. And the PMC ID is something that you need to be aware of if you have NIH funding.
Gotcha.
Did that answer your question?
Yes, thank you so much for clarifying.
Okay, of course. Any other questions? Okay, so now we'll talk about how does it get into PMC? How does it get into PubMed Central? Okay, so this is unnecessarily confusing, unfortunately, because there are four different paths for your paper to potentially become compliant, and the NCBI has named them A, B, C, and D. So that's not that helpful, but here we go. Okay, so basically, to be aware of our methods A and B, the publisher is going to do pretty much all the work for you for getting your paper into PubMed Central. Method C and D, the author has more involvement, and we'll go through each of these step by step. But being aware of method C and D is really important, because that's what, unless you publish in a particular journal, that's what you're going to need to understand how to do. And both method C and D involve using this system called NIHMS, or I guess people call it Nims, the NIH Manuscript Submission System. So Nims is the site where you upload your paper, where your paper eventually gets into PubMed Central. So you don't go to PubMed Central to like upload your paper to it. You go through this Nims submission first. So we'll look at how to do that. Okay, so we'll start with A. So method A journals are usually open access journals. They put all their NIH funded articles into PubMed Central automatically. So these journals know that the NIH public access policy affects these papers that were funded by the NIH, and they will automatically send the final version of your paper to PubMed Central. But this is only certain journals. So if you click on this link, or if you just go to Google and type in NIH public access policy method A journals, you can find this list. Which I might need to do because apparently my link's not working. Oh, there we go. Okay. Can everybody see my screen still?
Yep.
Okay, great. Sorry, I feel like I lost my green box. Okay, so these are the method A journals. So you can see there's, it's not everything, but it's a lot. And if you want to see if a particular journal is on this list, you can search for it here. This is actually a journal I published in because it's for medical librarians. So yeah, you can see this is the journal that I published in is on here. So that means that this journal will put my paper into Pubmed Central. I don't have to worry about it because the journal will take care of it for me. So that's how you can find out if method A is going to work for the journal that you published in. Most of these journals, not all of them, but most of these journals are going to be open access type journals where you may have paid a open access fee to publish with them. So that's just something to be aware of. Okay, and then method B, another sort of journal-centric method here. Method B journals take care of the compliance process for the most part if the authors opted in at the time of publication, usually by paying an open access fee. So in method A journals, usually you have to pay the open access fee, like to publish, they will charge you. In method B journals, a lot of times these are hybrid journals where you have the option to pay an open access fee. So you can see these are some big publishers like Cambridge or, LWW, JAMA Network, like the big publishers here will give you an option to pay a fee to make your paper open access. And as part of that, if your paper was NIH funded, they will put it in Pubmed Central for you. And then usually the paper is also open access on the journal's website. So people can read it either on the journal website for free and it's archived in Pubmed Central to read for free. Okay, so those two, so before I get into method C, which is its whole other animal, methods A and B have to do with the publisher and the journal that you're publishing with. Does anybody have any questions about how either of those work before I kind of jump into the do-it-yourself method? Okay, all right, so now we're going to the DIY. Method C. So if you did not pay an open access fee, or sometimes they call it an APC, an article process, basically if you didn't pay to publish your paper, you might need to think about method C. So before you get started thinking about your deposit, you do need to collect a few things. So you will need your ERA Commons username and password. If you haven't logged into ERA Commons in a while, if you have an NIH grant, you should have this username and password. But if you haven't logged in a little while, they do make you change your password a lot. So you may have to go on there and reset it. So just something to know, it's kind of a hassle sometimes. So you'll need that. And then the most important thing you'll need is the final author version of your manuscript. So I mentioned this at the beginning, but just to kind of reiterate, the final author version is not the published PDF. So it's going back to this example here, see where it says published in final edited form, and it's a link to the actual journal, American Journal of Men's Health up there near the top. So that's the publication version of it, the actual published version by the journal. And that is different from the final author version. So there may be minor corrections there, but really what it is that when a journal publishes your article, you sign over the copyright to them. So that version of it where it's got the journal's logo and their beautiful formatting on the PDF, that is copyright by the journal, and you are not able to upload that PDF into Pubmed Central or into Nims. And if you do upload that final version, like that PDF published, Pubmed Central, Nims, those people will come back and say, we can't accept this. So it'll delay you getting the PMC ID because they'll have to ask for you to upload a different version of the manuscript. So the final author version is the last one that you were working on. So probably your last Word file before you sent it off for the very final time. So it will have been peer reviewed and you will have made your edits post peer review. And then that's it. That's the file that you want to send them. And then along with your manuscript, don't forget to add any of your supplemental things, your tables, your figures. Those need to be, as you submit them to the journal separately, those need to be uploaded into NIMS separately. So make sure that you have all this together before you go into do your submission with Method C. Sometimes this is the hardest part, is collecting all this, because if you were doing your manuscript collaboratively, maybe somebody else drafted the bulk of it, but you're the PI, you know, it may take some time to get all this together. Okay, so once you have that, you go to the NIH manuscript submission system. So that's Nims. You can just Google this or go to this link. I'll show you what it looks like on my slide. It looks like this. Yes.
Can I just add one thing to the previous slide? I know that there's some folks on this in this workshop that kind of support investigators in uploading their manuscripts and also helping their investigators to be in compliance with the policy. And so I think folks, I mean, and correct me if I'm wrong, but I think for the support staff that does this type of work, that you don't actually need an ERA Commons, but you can also use your NCBI username and password too when you go to the NIH MS system.
Yes. So if you are supporting somebody and you don't have their login, which you probably don't, you can use your NCBI login. What's tricky is I believe they're about to phase that out. I need to go look into this because I saw the announcement, but I haven't thoroughly read it yet. But I believe what they're doing is they're phasing out those NCBI logins, so you'll have a different way to log into NCBI. But whichever route you log into NCBI with, yes, you should be able to use that login if you don't have ERA Commons, because they do allow you to upload manuscripts on behalf of a PI. So yeah, I should probably adjust that on my slide. Thank you for saying so.
Thank you.
Any other thoughts on this before we start looking at what it's like to do the upload? Okay. Okay, so yeah, you can actually see here's your login options. So NCBI account is one, bottom right there. So yeah, you can log in that way. And then most, if you are a PI and you have the ERA Commons, that's here in the top middle. And then, so this is what I was mentioning at the beginning. There's actually other agencies that use Pubmed Central and Nims as well, that have, you know, similar or differing in various ways public access policies. So that's why there's so many logins here. Tons of logins. Okay, so you'll go to this website, you'll log in. And then through if it's your first time logging in, they actually do have a pretty good like wizard to walk you through what to do. They improved this site a lot over the last year or so. So it's fairly self-explanatory, but there are things along the way that might be confusing. So I'm going to show it to you. But I did want to put in my slides that there are tutorials on the site. Actually, I'll show you what these tutorials are. And then feel free to also email me if you need help at any point during your deposit. Send me an email and we can work on it together. So yeah, so they have some steps. So I'll just click on the login tutorial. But you can see these are like really detailed login information. Honestly, their tutorials are really good. So take a look at those and then feel free to send me an email as well. But here's the gist of what's going to happen when you're in here. So if you go to over there in the top right, you log in. This is a dashboard. So if you have anything that's in the process of being submitted, or if you have submitted anything, it'll show you what the status of each of those are. That's what that bar on the left is. But if yours is like mine and you have zeros, then you can go over to submit new manuscript in the top right, and that's where you're going to want to start. When you click that button, so this is what I meant by kind of giving you a step-by-step little wizard that walks you through the submission process. The screen looks like this when you click that. So it's giving you information about what each of these buttons is going to do. So they've made this a lot better. In the past, it was really tricky because it made it seem like you were supposed to type in the title of your manuscript, and now they made it a lot more obvious that you can actually populate your paper's information from PubMed. So that makes it easy. So you can say here where it says PubMed and it says import citation data, if your manuscript has a PubMed ID, you can click on PubMed. So that's if you know your paper has a PubMed record, if it has a PM ID like we saw earlier, then all you have to do is click that PubMed link and well, you could search for it. In this case, I clicked PubMed and I did a search and I searched for my name. But so you could search for the title, you could search for the name, you could search for the PM ID. Basically, you're just doing a PubMed search here within Nims to try to find the paper that you're uploading. So yeah, however you want to locate it, you can do that. So keyword, name, PM ID, whatever. So I searched for it. And then when you found what you wanted to upload, you would click on it. Then you would proceed to the next step, which is associating funding. So this is similar. So they give you this little information here. You can look at the awards, and this would pretty straightforward. So you can search. So I did a search for Myers, even though I'm not a PI, so none of these people are me. But you can search by the awardee last name like I did here, or if you know the award number, you can search for that. So you will need to find the NIH grant that you're trying to associate with this paper. And there may be multiple NIH grants here, so you may need to do this more than once to add the funding. If you are doing this on behalf of a PI, you can actually skip this if you're not sure of every grant that supported it, and you can have the PI do it later when they review the paper. So I'll show you that in a couple screens. But if you are this little wizard will tell you. Yeah, oh, actually, no, it says behind it right here. If you're depositing files on behalf of somebody, the PI can add funding later, is what that says. It's behind the pop-up. All right. So then the next step after you've associated the funding is to actually upload the files. So the wizard tells you, like, you know, upload your manuscript files, upload your supporting files. You can see there's several places to do your uploads here for your files, your tables, your figures. So you would want to make sure those go on here. And once again, it's not the published version of your PDF. It's not the beautiful PDF from the journal. It's going to be probably a Word document that you wrote. Oh yeah, so that's what it looks like. So you would go through this screen. All right, so then so far so good. And then you're on the last page here that's called Reviewer and Release Delay. So the reviewer is going to be who does the next steps of this process. So the person who uploads all these files may not be the person who does, you may not be the author, you may be doing it on behalf of an author. So you may not be the person who's doing the later approval of the PMC version. They want somebody to proof it before it goes into PMC. So if that person is not going to be you, then you would want to change that here. So yeah, like the little pop-up box says, the reviewer should be either an author or a PI. Usually you would want that to be the authors because they need to check that the manuscript is correct. They need to check that after Pubmed Central has formatted it, everything is fine. So usually you want that to be the author, or one of the authors. So if that's not you, then you can, on that drop-down menu, it'll let you put in the email address of the person who it should be. And then the release delay, we'll get out of that pop-up. The release delay is the embargo. So as I mentioned earlier, Pubmed Central allows you to have, the NIH public access policy allows you to have up to a 12-month embargo. So what that means is you would put the paper in Pubmed Central now, like you would get your PMC ID now, but nobody would be able to read it for a certain amount of time until it becomes available to the public. So, so some journals ask you to do this. The maximum allowed embargo is 12 months right now. So if your journal has a 12-month embargo and you're doing this at the time of publication, then from that drop-down menu, you would want to select 12 months so that the public won't have access to it for 12 months. Some journals want you to do that because they want to have the exclusive, you know, the paper exclusively on their site for a certain amount of time while it's brand new. So that depends on the journal that you publish in. You would want to check what their policy on the embargo is before you select one here. If your paper is already passed, like if it's non-compliant and you published it a long time ago and you're just trying to make it compliant, then you would not want to put an embargo. You would just want to say, make it immediately available. Okay, so after this, what happens is there's going to be a period of time. So this could be a couple weeks. This could be, I believe they say technically up to 6 weeks or so, where they're going to be working on your manuscript and converting it into Pubmed Central. So while your paper is being processed, after you do the submission, but before it has a PMC ID, before it's finalized, you have an interim ID number. It's called the Nims Id. So that Nims Id is good to know about because that's, well, A, it's how you can track your paper in Nims, and B, if you need to report anything in the meantime, like before your paper has a PMC ID, you can refer to it with that Nims Id, and the NIH will know that you started the submission process, at least for that manuscript. So after they've done the conversion, so after it's ready for Pubmed Central, the reviewer, so I said you here, but it's actually may not be you, it's whoever you set as the reviewer. So that could be an author, or if you're an author, it will be you. We'll get an email notifying you for your final approval. So the reviewer gets the email. Their job is to click the link from the email, or if they lose the email or something, they can log into Nims and that paper will be there on the dashboard. So it'll be there on the initial screen that they see once they log in. And their job there is just to do that review. So the email will say, please review what we have. And their job is to make sure that it's correct, so that all the files that were uploaded were correct, and so that nothing got messed up during the conversion to Pubmed Central. So that final approval has to be done before you get a PMC ID. So sometimes this can get hung up. People miss that email, they forget about it, or they think that it was done because they did the submission. And that's, that happens sometimes and the paper gets stuck here, but you have to do that final approval. The last step is on the reviewer to do before you'll get assigned a PMC ID and your paper will be compliant. So this is a nice graphic they had of the process. So depositing the files. So anybody can deposit files. The reviewer should probably be an author, and then the reviewer will know if this happened. So if you are supporting somebody and you do deposit their manuscript, they'll get an email that you did that, so they'll know. Then the initial approval, that's part of the deposit. So somebody has to make sure that the funding was assigned. If you didn't do that during the steps that I showed you, if you delayed it because you're supporting an author, then the author will do it when they see the submission. So then converting to Nims, so they do that on their end and you're just waiting. Then final approval, you'll get the email, make sure that you approve the way that the Pubmed Central manuscript is looking, and then a PMC ID getting assigned, and then it's available in PMC. And you'll have your PMC ID and it will be compliant. Actually, it says available in PMC, but it's possible if you set an embargo on it that you'll have an ID number for it, but nobody will be able to see it yet. So it may not be openly available yet, but yeah, but you'll have the number. And during this process, usually it works like that and it's fine, but it's possible that if you uploaded, sometimes what happens is there's errors with the upload. So, sometimes people will upload the published PDF, which is copyrighted, and they'll go back and say, we can't use this file. Sometimes people will upload a manuscript that maybe wasn't the final version, and there will be, a reference to a table that's wrong or missing or something like that, and they'll write back and ask you to re-upload the files. That's usually what happens here. If there is a delay, it's usually because of the files. Otherwise, you just have to wait. So before I talk about method D, I know that was kind of a long step through of method C, but it is, if you have everything together and you log into Nims, it usually only takes minutes to do your deposit. It's not terribly difficult as long as you have all your files ready to go. But does anybody have any questions? I know I went over it quickly.
I have a question.
Yeah.
I'm not sure if you can hear me. Okay. So if I'm a PI uploading the manuscript on behalf of a publisher within an organization, but he also has funding from other places, is he able to later on select all the funding he has received?
I see. So you're saying that you would upload it with the grant that you know about, but there may be other grants?
Yes.
So what I would probably do is actually check the manuscript. So usually this is on the manuscript, the funding. So the easiest thing to do would be when you're doing the upload or when the reviewer is doing their initial approval, like either step 1 or 2 here, to look at the manuscript and whatever NIH grants are actually listed in the funding on the actual paper, go ahead and add those. That's the easiest way to do it. You can associate it with a grant after the fact, so it's doable. But you might as well do it all at once. Like it should be listed on the paper, and you might as well do it all at once. But yes, after the fact, if you need to associate it with a different grant, the PI of that grant can do it in their My Bibliography, which I'll show you My Bibliography in a second. But yeah, usually the grants are listed on the manuscript, and you kind of might as well knock them out if does that make sense?
Yes.
Yeah, I know sometimes people don't put, like sometimes there is funding missing from the manuscript, which is a bummer. So in that case, yeah, you could do it after the fact. Let's see. Oh yeah, in the chat. In your manuscript, in acknowledgements or funding, that's where it would be. Any other questions?
Also, can I make a note, Bethany? And correct me if I'm wrong too. I know that, like, for example, there's oftentimes manuscripts have different funding sources. And so you might have a funding source that is, let's say that there's like 4 funding sources, and some of it could be state funded or some of it could be private. But if one of your 4 is NIH, then you still have to comply with the NIH public access policy. Isn't that correct?
Yes, absolutely.
And also just to note too that for all the ones, so you won't be able to find only the NIH funding awards will be listed in the NIH MS system, but not any of the other ones.
Right. So, so that may not actually be entirely true. There may be other agencies that also use, so the other agencies that use this, like ARC, or like, I think even like NASA there may be other federal agency grants in there that also use the system, but no, there won't be like private grants in there. I'm glad you brought that up too, because the other thing to note is if you have multiple funding sources, you may have another open access policy that's attached to one of your grants. A lot of big private funders, like the Bill and Melinda Gates Foundation, for example, like they have their own open access policy. A lot of other funders do. So you would want to check what the policies are for each funding source that you have, because if you have any NIH ones, you'll have to do this, but you may also have to put your paper in multiple places or let them know that you've made it openly available in PMC. You may have multiple obligations if you have multiple funding sources for making your paper freely available.
Great, thank you for making that clarification. That's helpful.
Okay, so then method D. So on this, so see where it says anybody can submit files here. So the other person besides, authors, PIs, and people supporting authors and PIs, the other people who do file deposits are publishers. So that's what Method D can be. So some publishers will do that first deposit for you. And usually that's something that you're going to be opting into. So like that's an example of what it used to look like for Nature. Like you can let them know that this needs to go in Pubmed Central. So when you're submitting your manuscript, tell them that, and they'll usually do that first step for you. So uploading it into Nims. You will still have to do, so you or an author will have to do step 2. So the publisher will do step 1, put the files in there, but then you will have to, check the email that they will send the reviewer. You, the reviewer, will have to check the email that they'll send you and make sure that you approve it. So the publisher will put the manuscript in there, like what you submitted them, they'll submit to PMC, but they won't finalize it for you. The reviewer would still have to go through and approve it and make sure that it's right. So they only do one step of that, and then the reviewer still has to do the other several steps. So look out for this. If you're submitting a manuscript that was NIH funded, make sure you check a box if they give you the option to do that, because it'll save you a little bit of work. Okay, so before I jump into the next section about looking at your compliance, does anybody have any questions about those 4 methods? So again, A and B are kind of the open access journal options to be aware of, particularly if you've paid an article processing charge. And then C is the one where, if your journal is not going to help you out with it, you're going to have to do it. And then D is the one where you probably checked a box while you were doing the submission, and they'll do step 1, but not the rest of it. Any questions about those before I move on?
I have another question very quickly. What's the purpose of having an interim ID?
So that's to track it. That's to track the manuscript in between. So it could be weeks and weeks. Like, I mean, technically it could be months, like a couple of months before you get a PMC ID. So it's just to track where the paper is while it's in these middle phases here. So like between step 2 and 5, it's just to track what stage it's at. So if you log into Nims, you can see what stage it's at. It'll say like undergoing conversion or something. So it lets you know that they're working on it. And the Nims ID is also useful if you need to do some reporting in the meantime. Like sometimes people don't realize, they don't do this always right when their paper gets published. So they have, they need to renew their grant, and the fact that you have a Nims ID means you've started the process of compliance, so your program officer can see that, and that can be helpful. Oh yeah, the training grant information in the chat. Yeah. So if you are getting support from an NIH training grant, yeah, you do have to cite it. So you need to cite it in your paper, and you need to upload it to Nims. It's important to note too, I should have said this at the beginning, but who has ultimate responsibility for all of this is actually the PI, because it's the PI's money that's on the line if their papers aren't compliant, like any paper citing their grant is not compliant. So, authors should do this because the authors who wrote the paper are the ones who have the manuscript, but really who's gonna be affected long-term is the PI whose money it is. So, you may be hearing from a PI if they need you to do this, because, and it may be an emergency if you hear from them. So yeah, it's good to do it early so that that doesn't happen. And by early, I mean when your paper is published. Okay. Okay, so how do you know, what you need to do here? If you want to see what things you've published in the past, are they compliant or not? So what you would want to do is go to my bibliography. So I can show you real quick how to get there. So if you're in PubMed, let me just click on my PubMed URL here. Your My Bibliography is when you've logged into PubMed, which is in the top right here. So you can see my account. Oops, actually, publications. There we go. So this is my bibliography. So you can see if you have a grant, if you have an ERA Commons, it'll be linked to that. You have the option of sharing this with people, which is a different presentation. But here's your bibliography. These are the papers that you're an author on or a PI on. Oops. Start my slide again. So, well, actually, you can see it on mine. So I'll just show you here. You can see my compliance status is right over here. It's the green and the red. So this one's not defined. This one is compliant. So if they're green, they're compliant. That's great. If they're red, then they don't know. So what you would want to do here, public access compliance not defined. So you would click edit status. Did the NIH support this citation in whole or in part? So you can say yes or no. If you say yes, then they give you this whole spiel so that you're subject to the NIH public access policy. What do you want to do about it? And then you can either start to deposit your paper from here, which that's cool. You could put your Nims Id. So if you've started your, you don't have to do this if when you went to do your deposit, you chose PubMed. So let me show that again real quick. So remember at the beginning or earlier, I was saying the first step of submitting your manuscript, you can search PubMed for it. So like I can go through Nims and say, oh yeah, this is the PubMed record that I want to link here. If you didn't do that, instead of that, you did right here where it says enter manually, like behind this pop-up, and you manually typed it in, then without having that PMID, the system doesn't know that that deposit is connected to a certain PubMed record. So to connect them, you can do that through here. So you can give your bibliography the Nims ID, and it'll say, oh, okay, that deposit matches this article. So that's another use of the Nims ID. And then you can say it's method B. So if you had paid an open access fee and one of the journals was going to submit it on your behalf, you can check that box, or you can make it exempt. So there are some things that are exempt from it. If it's old, if it's not a Latin script, if it wasn't directly supported by NIH. So that's a whole technicality about like direct and indirect, and they explain it through this link. We don't have to worry about that right now. But the big one is that it's not peer reviewed. So sometimes grants will end up on things that are like editorials or letters. People will cite a grant on there. And if it's not a research paper that was peer reviewed, then you can mark it exempt and save. So that's how you can check your compliance status here. Or if things weren't NIH funded, then you can change that there. So then somebody was asking earlier about adding awards after the fact. So do you see how, I should have explained that. So you can see that there are awards. I can click add award for something with no awards. And if there is a paper in here already that has funding attached to it, but I want to add or edit that, I can click on it and then I can click add other awards. So you can add awards after the fact. Yeah, I mean, this is how you would do it. Same kind of search as in Nims. Yeah, so that's what I was showing there. Okay, so that was most of what I wanted to demo for everybody. Are there any questions?
I had a quick question. You said that like the NCBI thing was going to be phased out. Is that only pertains to the NIH MS, or does that also pertain on the PubMed website?
That's PubMed too. So let's, I'm glad you asked that. Let's go look at it because where are they talking? Here, let me find out and then let's actually look at it because I should have probably memorized this by now. But I saw a message saying that they were changing it, but it's basically the NCBI login. So wherever you log in with NCBI credentials, oh, now it's not going to work for me. But right now my login is like, you know, I have a separate username and password for NCBI. So I use that to oh, yeah, that's great. Oh, here we go. Yeah, here we go. Okay, so login update. So let's read this. So I think what they're doing is deleting NCBI managing login credentials, and they're going to make you log in through a third party. Yeah. Here, I'll put this in the chat so I know we're about to run out of time so that everybody can look at it later. But NCBI doesn't want to handle logins anymore, so they're going to make you log in through like Google or like Facebook or ERA Commons or some other. They don't want to manage the login; they want somebody else to manage it. So this will change everywhere that you use an NCBI login. And that's in the chat. So yes, your PubMed login will change too in June 1st.
Wow, that's pretty soon.
Yeah. Yeah, I know. I probably need to decide how else I'm going to log in. I'll probably just use Google.
So so will it be this true when they make this transition? So like I know that the recommendation before was that if you log in using NCBI or your ERA Commons account, that you should stick with whatever account that you use. So if you're going to be transitioning to using Google, that you should always log in using your Google account. Is that my understanding?
I think so, yeah. If you have an ERA Commons, it is good to log in that way because that's going to connect, for those of you who are PIs, that's going to connect anything you've reported as a paper associated with a grant in ERA Commons. You'll be able to see that in your My Bibliography. So it's good to have those synced up. And yeah, you like your grants, you can connect it through these other, I think you can connect it through these other federated ones too, but it's, you know, it's more direct to just use your Commons. Any other questions?
I have a question. So let's say I am reviewing on behalf of a co-author, and I'm trying to see who originally submitted the paper. Am I able to do that as, even though I'm not the PI, or am I also, let's say in the event I'm unable to locate the original manuscript, how would you proceed in that scenario?
Sorry, can you say that again? So somebody, are you saying somebody else submitted it on behalf of you?
Yes, like I guess my question is, if I didn't originally submit the manuscript, am I able to kind of log on behalf of a co-author and see who submitted the original manuscript? I don't know if that makes sense.
Oh, I see. So somebody else did it, and you want to know, has it been done?
Yeah.
So you can search. That's actually a really good. Oh my gosh, I need to move my screen around. Sorry. That's a great question, and the answer is you can search in Nims to see. All right, so I can search. So if you know a PMID, like, oh look at the test submission. If you have a PMID, so this is your paper. This is your paper's PMID. So you look the paper up in PubMed, you copy that number. I don't know what this paper is. You can search, yeah. So like that, I searched that PMID, it gives me a result. So here's the Nims ID. So this was the paper's record in Nims. And I can see, I guess I can't see who submitted it, but I can see who the reviewer was. So if the submitter assigned somebody else to be the reviewer, then I guess you would only know the reviewer. But yes, you can see that somebody has done it or not.
Gotcha. Okay, that's really helpful. Thank you.
Yeah. Any other questions? great. Yeah, Elena put some information in the chat. Thank you so much. So thanks again, everybody, for coming. I really appreciate you taking the time to join us today. And again, here's my, actually, let me just put this in the chat too. I'll just put my email in the chat. Feel free to send me an email if you have further questions, or if you want help doing this deposit, hit me up and we can screen share and do it together.